And everyone's been, as you can imagine, kind of rushing around, plans changing at the last minute, but it's really brilliant. We've got two of our GPs here, Dr. Steven Clarke and Dr. Peter Bibway. So at some point, I'm going to ask you to just turn your cameras on and say hi. And also our Managing Director for the Clinical Commissioning Group, Daryl Gasson, is here, and he's going to be starting us off in a minute. Just to let you know, if you've got questions, could you please put them in the chat? Because what we'll do is Ellie, my colleague, will gather all of those up, and we'll have some time during the session to hopefully answer most of those questions. If we can't answer anything today, we will definitely come back to you and make sure that we answer your questions after the meeting's finished. If you're happy to keep your camera on, it's sort of nicer for us because we can see real faces of real people rather than just a black screen. But if you're still in your pajamas or whatever else, then please feel free to turn your camera off. If you can keep your microphone muted, that'd be really helpful because it just stops all the sort of interference for other folk as well. We are recording the session. So keep it clean, folks, and we'll put that on the website afterwards for anybody who isn't able to make it sort of here and now. So I hope that's okay with everybody. Sorry, I should have said, my name's Kathy Atkinson. I know so many of you already, so it's lovely to see you, but I'm a lay member at North East Hampshire and Farnham CCG, and I've got a particular interest in patient involvement and public engagement. And I've been very, very part-time at the CCG for about 6 years now. So yeah, it's a great place. So I'm going to start by asking Daryl to give us a bit of an update on all of the stuff that I know you're going to be really interested in around the pressures and the stresses and the hope, hopefully, around COVID locally. So Daryl, are you there? Would you like to come on in?
Yes, good afternoon, everyone. Thanks for joining us, and thanks, Kathy, for the introduction. Kathy, can you hear me?
Yeah, I can hear you.
Yeah.
Can everybody else hear Daryl?
Yeah, excellent, thank you. As you can imagine, everyone, our main priority right now is COVID and COVID vaccinations, and you'll hear more about that in a moment. But in other news, and just to get it, just so that we can then concentrate on the kind of the main things, what's going on at the moment, just to let you know that since we last spoke to you and since our AGM, we have voted in favour of merger of the CCG, and the constitution has been agreed and approved by our GP practices. So we will be going ahead with the formal merger from the 1st of April, and all things going well, from 1st of April this year, we will be known as NHS Frimley CCG. So that's all happening in the background, hopefully not taking up too much of people's time. And at the same time, we're continuing to work with all our other partners in the Frimley ICS, that's the integrated care system. So we work closely with Frimley Health, the main acute provider, the mental health and community providers, our local authorities, and other groups as what's called an integrated care system. And that there's sort of national directives to progress that work. So we're still working on those sort of things as well in the background, and that's going really well because the Frimley ICS is, one of the most advanced in the whole of the country, and is looked up to set the pace for the rest of the country. So we're working on that very in the background whilst trying to stay abreast of the kind of pandemic situation at the same time. So next slide, please. So just in terms of the local situation, in terms of COVID, I mean, you'll know as well as I do that obviously nationally the infection rates have been rising and continue to rise, and that locally we're not immune from that. And indeed, we've seen a dramatic rise locally, and Rushmore is one of the highest rates in the whole of the southeast as of last week. It keeps changing, so there will be other places that go high going forward, but right now Rushmore is right up there. So we've got an underlying high level of infection out there in the population. At the same time, our GP practice, our primary care is extremely busy, and as a result has is now working at what they call level 4, level 5 being the highest, which is where the situation is overwhelming. So we're one off the highest. So basically, primary care GP practices are extremely busy, even without getting involved in all the vaccinations. So Steven will talk to you later about how you can help, or how you can put the message out to our communities as to how they can help. So that's one thing, one area. And then in terms of Frimley Park, I just thought I'd give you an update on some of the numbers there. So you'll have seen in the news and everywhere that the NHS and particularly hospitals are in dire straits, and Frimley Park is no different. So at the moment, they've got more than 300 COVID inpatients at Frimley Park. That's more than double that they had in the peak in April. So they are, not overwhelmed, but pretty full with COVID patients. And unlike April, we've also got the winter admissions as well coming in. So it's a very busy place at the moment. In particular, ITU is very busy. Normally they would have 12 ITU beds. Currently they've got 24 open, mostly with COVID, but also with some other patients. So that high level of demand is also unfortunately coupled with a high level of staff sickness in the trust. The new variant of COVID is highly transmissible, as you will have heard. And despite them vaccinating a lot of their staff, they do have a lot of staff off ill. So the combination of high demand and high sickness is makes it a pretty difficult situation in the hospital. And as a result, some ITU patients are being transferred out of the system, and that's happening on a regular basis. And some of those patients who will be local patients will be going further afield. I heard today that some have gone to Devon and some have gone to the Midlands. So it's not huge numbers, but just be aware that the pressure is so great, and that's a really unusual. In normal times, patients don't go any further than that. Also, another consequence is that some high priority surgery is being cancelled. So the trust had already cancelled the sort of low non-urgent surgery, but equally some high priority surgery has been cancelled. Hoping that get that back up and running again, but there has been that consequence, which didn't really happen in the first wave either. So just to show how bad it is, I suppose. And on top of that, the trust have been asked to plan for further admissions, i.e. the peak getting even bigger on the back of that Christmas relaxation or slight relaxation. So they have been asked to contingency plan for further COVID patients coming in. And so they are looking at using hotels, using the local private sector to take patients. So there's a lot going on in the local hospitals. So I think that not to make it too much doom and gloom, but that was just to set the context so you know what the situation is like locally. And I think I'm going to pass over to Steven now, who's going to tell you about how you can help or how your communities can help.
There was a couple. Thanks, Daryl. There was a couple of questions. Are you going to pick those up, Ellie?
Yeah, we can pick those up now. There's some specific questions around the impact of the ICS legislation. So what would the ICS getting legislative powers mean for the system? And also some clarification about what the difference would be between a Frimley CCG and a Frimley ICS.
That's quite a big topic, isn't it, Ellie? But I'm really conscious that we need to find some time to do it. I don't know whether it's possible to do a sort of quick answer now, but I'm really conscious, Martin and others, if you're interested in actually, how this is going to have an impact on the way the CCG operates, maybe we need to try and schedule a separate discussion on that, because I just think we need a little bit more time than we've got today. Daryl, what do you think?
Yeah, I agree. It's a big topic, and it's less the focus for today. I think it deserves a kind of a separate discussion on its own, as you say, Kathy.
Okay, so Martin and others who are particularly interested in the integrated care system and the plans for the CCG to merge, should we try and get a separate, I'm looking at Steve and Caroline and Ollie from the comms and engagement team, and Ellie particularly, just to see whether that's feasible. Maybe we can use the community ambassadors network and other networks that we've already got set up to talk specifically to people who are interested in that.
Yeah.
Yeah?
Yeah.
Yeah, cool. Okay, let's do that then, thanks.
Okay, so this is, so shall I take over? Sorry, Kathy, yeah. So this is a slide which has been developed from Frimley, and basically it's a summary of where people can go for help and advice. So it's a fairly simple slide, but obviously there's some initial advice at the top if you think you might have some COVID-related symptoms. And then there's the usual breakdown of familiar advice, such as care at home, advice from the pharmacy, but there's an extra topic in there, 111, which I'll come on to in the next slide, that we just wanted to expand and give a little bit more meat to and explain exactly how that will help. And then people are aware they can get in touch with their GP, and in the event of emergency, they know to phone 999. And under each one of those, there's sort of brief examples of the sort of things you might sort of seek advice for each element of that's presented there. And at the bottom of the slide, there's some information about mental health, and again, how you might access that through 111. So can we have the slide on 111?
Stephen, just before you hop onto that, is it possible to just, there's a question from Miriam about GPs and sort of the sort of rumour being that GPs are not available, and I just think we probably need to address that one and sort of bust that myth. Are you happy to just pick that up?
Not sure how it's worded, but absolutely. Throughout the whole of the COVID pandemic, we've been open for business. We have changed the way we meet people's queries. Most of it is now done remotely, but we have continued to respond to phone calls and e-consults in particular, so people are sort of accessing help in a different way. We are getting people down to the surgery that need to be seen face to face. So all those elements are in place, and I have to say, if you look at the statistics, particularly in the latter part of 2020, so September onwards, if anything, the activity and the work we're doing has equaled, if not gone above, the levels of activity for a similar period the year before. So it is very busy, and we are open for business, and we are seeing patients face to face that need to be seen.
Thanks, Stephen. Yeah, I think the message sort of nationally and locally is that if you need to see a medical professional, then you can. It may be that you are directed to a different service provider, pharmacist, or some other sort of local service, but certainly people should be able to get help if they need it, particularly in emergencies, obviously. Thanks, Stephen.
So back to 111. So 111 is basically a service that you can access advice if you're not quite sure where to go, and is not a service for which you need to phone 999. It's a service that is available for 5 years of age and above. And if you're not quite sure exactly where the best place to go, you can call 111 or go online, and you can explain your problem and concerns, and they will direct you to the most appropriate service. So they may well advise you to say, yes, this is nothing to worry about, care at home, or see a pharmacist. They can book directly with your surgery. So they can send a note to the surgery and ask the surgery to contact the patient with a brief summary of the problem, and then we can get back in touch with the patient and follow that up later in the day. And indeed, if it is an urgent problem requiring A&E attendance, rather than advising patients to actually go to A&E, they actually book an appointment time. So this is a service that will enable appropriate people to be seen in A&E, but also book a slot so they don't have to wait and mix with lots of people in A&E. So yeah, this is a really helpful addition that started at the end of November and is going very well. I don't know if people have had experience, but it's certainly it is working well. So that's how people can help seek care where it's most appropriate to do so. And because we're at level 4, Daryl mentioned that it's a different level of service that we are currently offering. We will be shortly putting a specific message on our website that we will be focusing on urgent problems. So it's a really important message to get across that we are open for anything that needs to be seen, anything urgently, but minor issues, we might say, we'll come back to that later in the year. We will continue to see problems, still continue to respond appropriately, but we need to free up some of our practice teams to deal with the COVID hot sites and the COVID vaccination program. So we will slight prioritization of our work within practices, particularly over the next 3 months. So happy just to sort of pause there if there's anything that people wanted clarification on.
There seems to be a bit of activity in the chat still around the issue of accessing primary care. Stephen, I don't know if anybody in the forum would like to just maybe articulate, if you haven't your answer hasn't satisfactorily been given. Is there something else that you'd like to hear from, particularly from our primary care colleagues?
So one of the questions.
Can I speak now? Sorry. Can you hear me?
Yes.
Yes, we can.
Sorry, it's not clear on my screen. So you still want me to have a quick word, Kathy? Yeah, or yeah?
Yes, go on then. Yeah, yep.
It's not time for me to say a great deal. I'm just saying what I said in the chat, and there is a real perception, and there certainly was, by the public that I know. So I'm one person with some contact with a small number of people. But it's interesting what's coming up on the chat. I just feel it mustn't be dismissed, and at some point in the future when perhaps things are a little bit easier for everyone, looking back, this might be an area to look back on, and it may be that it couldn't be helped, but the impact needs to be debated, and as part of this is about change. I mean, there's lots of bad things from this virus, but there's perhaps some positives in terms of the increase in technology. I would support that, but that has come at real speed, and I just feel people need a chance to talk about how they felt, because there's certainly lots of people felt they could not speak to their GP practice, let alone their GP. And some people now feel very strongly they can never see their GP face to face again. That's all I have to say. Thank you.
Thank you, Valerie.
Kathy, can I come in?
Of course you can, Peter.
Yeah, thanks. I mean, you know, it's a really important area that, as Valerie said, that we can't kind of just brush over. I think it is a real perception that the public feels. So so it is quite real. I mean, what I will say is that as well as the innovation that came post-COVID with the digital innovation, but that in itself has created some digital inequalities from our elderly population. So it is something that we're very aware of, and we're looking at ways of how we do that. And like Steven said, we are seeing patients face-to-face when needed. And there are a number of face-to-face options. You know, one is in the practice itself. Second is through the paramedic practitioners that will still do home visiting to those who can't get to the surgery. And third, through the hot sites. So those who have confirmed COVID could be diverted to be seen in primary care. But I agree with Valerie, and I think we need to look at ways of how we can tackle the kind of emerging digital inequality in the new digital age, so we ensure that access is available to all.
That's a really important point, Peter. Thank you. And thanks, Valerie, for raising that, and others in the chat. Just in the interest of time, I wonder if we might be able to move on, because I know you want to hear about the vaccination programme and plans as well, because that's obviously of huge interest to folks. Is that okay with everyone? Steven, are you going to pick this up again?
Absolutely. Is that so? Just bear with me. Okay, so the vaccination programme, this is a significant priority for the CCG. We started work in December, and we are rolling out a number of sites. We're really pleased that they've gone incredibly well so far. Yateley was the first to go, quickly followed by Farnham, and then we've got 2 other sites in Southwood and Aldershot. And things are in place, and we're slowly moving through the tiered cohorts of patients that have been laid out by the government. So next slide, please. So these are our 4 sites. It's probably worth saying a little bit of a story, because I know there's people on the call with a particular interest in what might be happening in Fleet. So initially, when we were looking at sites in December, our initial remit was to find a single site which was big enough to take the population of the CCG, and it quickly became apparent that there wasn't an obvious site, and we started going ahead with 3 sites. So that was Monteagle, Southwood and Farnham Centre for Health. It later, as we were progressing those sites, the opportunity came up for an additional site in Aldershot. So we decided to support that. So this is a really positive story that we've got 4 sites for our populations, which are local and accessible. It is noticeable that some people may think, well, what about Fleet? So we have got a community pharmacy site in Fleet, and hopefully that'll be going live, hoping to get clarification tomorrow, exactly a go live date. So the initial intention was probably not to have a site in each of the networks. Our initial intention was a small number of sites for which people would travel to. And I think it's really important for context just to realise just how complex it is to set up these sites. Huge amounts of work to identify appropriate sites, to meet the specifications that were set upon us, to get the buy-in, to get the IT, to get the refrigeration, the background, that there are parking, access, etc., etc. So it's been a huge effort to try and get these sites up and running. So there is a plan for all our networks. Obviously, the practices for Fleet in particular will be distributed to these 4 all these sites. So we have plans for Fleet Medical Centre to be linked with Yateley. We have plans for my own surgery, Branksome Wood, to be linked with Prince's Hall in Aldershot, and Crondall is linked with Farnham Centre for Health. And the plan is for Richmond probably to be linked with the pharmacy site in Church Crookham, which is within their catchment area, when that goes live. So the sites are up and running, we're seeing patients, and everything is going really well. So this is a positive story. just to say, we've also, in addition to the sites up and running, we're also focusing on our care home residents and their staff, together with our frontline practice staff, and we've now been able to pretty well vaccinate all those care homes, those registered with the CQC. And again, this is a real positive message, and we're now focusing on the over 80s, and we are aware of having to try to vaccinate all the over 70s and vulnerable people by mid-February. So next slide, please. So everyone will be invited according to the priority groups. I recognise there are a lot of people that don't quite fit into the certain priority groups, and there's lots of questions being asked. There is more information coming out next week with regards to how we can get those people that are asking questions about how to get their vaccination, because they are a frontline worker. I heard this morning that across Frimley ICS, they are planning to vaccinate 30,000 health and social care workers. So the numbers are really big. And in total, by mid-February, we need to have vaccinated 40,000 people. So our CCG is doing really well, and it's probably worth noting that as an ICS, we have vaccinated probably we are leading the COVID vaccination board, if you like, in the southeast. As a whole, we are really we are ahead of the game. So still a lot to do. The main limitation at the moment is availability of vaccine, but that supplies should really improve next week. I think was there another slide, Ellie? Oh yes, so just to remind people, lots of questions I know, but try and resist contacting your local surgery. As soon as we get the go-ahead, we will be in contact. We encourage people to book their appointment and attend their appointment. The DNA rate is extremely low, and if you're offered a particular vaccine, we recommend and encourage you to take it up, rather than choosing which vaccine you would prefer. So if offered, take advantage of it and book the appointment. Thank you.
Thanks, Stephen. There's a few questions. We probably won't be able to get through all of the questions this afternoon, but let's try and get through some of them. So there's a few questions specifically around fleet. I don't know if we get into a lot of detail around fleet, I might suggest that the fleet contingent has a separate discussion outside here. But Stephen, I don't know if you're able to respond to the question about the location sites in Fleet, Leisure Centre, Harlington Centre.
So yes, there was the option to explore the Harlington Centre. I think at the time we were so focused on trying to get the existing sites up and running, there just wasn't the capacity to invest and get the Harlington Centre option available. As I say, the model really was to use 3 sites and for the other surgeries to home into those other 3 sites. So the original plan was to really focus and get those sites up and running as a priority. So all effort was harnessed to get those 3 sites up. A 4th site became available as well. So because of the particular needs in Aldershot, it was felt that that should be supported. And that did mean that Fleet didn't get a 5th site. But we have covered the population by distributing the population to those other sites. So the important thing is people will get access, and we will work very closely and collaboratively with our colleagues in those areas to ensure that our patients in Fleet get a fair share of the available vaccine, and we will ensure that those people that can't get to those sites, we will make alternative arrangements in Fleet to ensure that those people who have difficulties will still get access to it.
Thanks to Rushmore Voluntary Services also for putting the information in the chat about transport for people who might need transport within Rushmore. That's really helpful, thank you. Then there's a question about vaccinating housebound over 90s. I don't know if either Peter or Stephen, you're able to pick that one up.
So well, I'm not sure about the over 90s, I think is all housebound. We do have a list of housebound patients. We are waiting for the AstraZeneca vaccine in particular to come more available, and that will enable us to travel around people in their homes in order to give it. So it's not quite freely available for us to do a big rollout of that at the moment, but we will be working through our housebound. Some of that will be done by the practice staff, some of that will be done by the community staff. They're already on their caseloads, and each network will liaise with one another to ensure that the housebound are covered. But that will probably be a couple of weeks' time before we start going with that in a big way.
Thanks, Stephen. And maybe Peter, I could ask you to just answer the question about Farnborough Centre for Health. Is this instead of or as well as Southwood surgery?
I'm not close to what's happening in Farnborough, so Daryl might be able to clarify that.
Oh, okay, thanks.
Yeah, as far as I know, there's no plans to use Farnborough Centre for Health. It's Southwood for that patch. Okay,
thanks. And then there's a bigger question about policies towards the double dose of the vaccine, or whether we are going with the current government instruction on one dose. Daryl, again, do you want to pick that one up?
So from what I understand, we are sticking to the national policy, which is very strictly changed to give a single dose and a second dose within 12 weeks rather than within 3 weeks. And that's being strict. We're being encouraged to strictly adhere to that.
And that's quite a recent change, isn't it? Because certainly people who were booked in for their second dose in the first week in January, I think many of those will have got that second dose. So there's been a bit of a sort of a national change in policy in the last week on that.
It's quite a significant change, but it's clinically driven, because overall they've proved that it will save more lives by doing it this way around. And they're keen to emphasise it's a clinical decision to change that protocol.
Okay, thanks ever so much. So I think those are most of the sorts of question areas that we've had in the chat. I've really picked up from this that there's a need to have two further conversations. I'm not quite sure how we structure these, but I'll look to my colleagues to help think about that. One is around GP access, both I guess in the short term, the messages to people that the GPs, GP services are still open for business, although there may need to be some sort of prioritisation, perhaps of non-urgent things, but also looking into the longer term, and particularly taking into account the fact that so much is happening online at the moment rather than in person. So I think there's another conversation we need to have about GP access for folk, primary care access. And the second thing that came out, certainly for me and Martin and Eleanor, was just, I guess, to understand a little bit more about the two elements of the sort of structural changes. So one is, what does the CCG merger mean? Hopefully to patients, they won't notice much difference, but it will be good to talk through with you kind of what that means in terms of the organisation of services and how services are provided. And the second thing is around the actual statutory change that has been flagged up as a possibility by NHS England, which is to move to a statutory integrated care system, and that's a bit of a longer term ambition. So we'd be very happy to talk to anybody who's interested in those two areas, but I think we probably need to do it after today, if that's okay with folk. Is that all right?
Can I just make another comment before we
yeah, of course.
Actually, I just looked at the one of the questions was I mentioned Farnborough Centre for Health. Actually, I think that was Farnham Centre for Health, also known as Farnham Hospital. So just for clarification. And I suppose just on access to GPs, there is a perception. So just to reverse it slightly, I did mention the activity in GP practices is actually higher than it used to be. Because of the digital access, actually there's a lot of perception by GPs that the access to general practice has never been better. The availability of people to go online and put in an e-consult with their query, usually for that to be answered, if not by within 24 hours, then by within a few hours, has meant that the number of queries and access to general practice is exceptionally good. And although we're only getting a small number of those people down to see face to face, it's putting a lot of pressure on practices with regards to managing the number of e-consults that are coming through. So, as I say, there are two sides to that: concerns from the patient, but also, you know, just to put the other side of the story from the doctor's point of view as well.
Thank you, Steven.
Kathy, can I pick a quick question?
Of course.
As well? So I think this is Ian Penfold. He raised the question about people with learning disabilities are 5 or 6 times greater of death from COVID. I mean, and can they be prioritized? Obviously, the priority groups are mandated nationally by the Joint Committee for Vaccination. So it's not a local mandate, it's a national one. But I just wanted to say that, that as clinicians, we're very supportive of that. In fact, you know, there's a lot of push and drive towards getting the Joint Committee to do exactly what you've just highlighted, Ian, about learning disability. So let's hope that that can be reviewed soon.
Thanks, Peter. There's also a question from Mark about rapid testing kits. I don't know who to address this to. I'll start with Daryl. Daryl, can you help at all on this one?
I'm sorry, Kathy, I don't know much about that at all.
Anybody out there?
There's something called lateral flow tests that are being rolled out. I mean, care homes are using them, practices are receiving them. So they are, I'm not sure which organisations will be able to have access to them, but they're certainly being rolled out. So staff are being able to self-test over a 12-week period, so the next 3 months, just to confirm that they are COVID negative, which will hopefully reassure practices and those other organisations, but also patients coming to see them that the staff are having those tests and are negative. So they are being rolled out.
Stephen, where do they come from? Is it nationally sourced?
Nationally sourced, yes. You go online, you order them, and that they're being distributed, well, now, basically. Yeah. Okay,
thank you. One more question in the chat from Eleanor. Oh, hang on, no, another one. Any experiences regarding difficulty obtaining hormone treatments, and any news on vaccinations for domiciliary care staff?
I believe domiciliary care staff are prioritised in Group 2, and that's kind of imminent for all staff around the Frimley system, as part of health and social care.
Yeah, I mentioned there was about 30,000 health and social staff, and that very much includes the social care and the domestic support in order to get people out of the hospital. So they're really keen to have these people prioritised and vaccinated. I think there's some communication planned for the beginning of next week. I say a lot of these people are already known, but there's also other people who might not be known, and we'll be encouraging people to contact possibly practices, but to be confirmed, so that we are getting them on the database, so that we know how to get hold of them and prioritise them in those groups.
Thanks, Stephen. Right, just picking up some more questions. We'll probably take another couple of minutes of questions and then move on to the next section, and hopefully we'll have some time left at the end. Drive-in testing centres not meeting standards with testing. Hang on, these questions are coming thick and fast. We're still no, I think that's it. Autistic, any advice or directions for autistic people as how to access their GP services during this time? Is there a particular set of advice or directions for people wishing to get GP services at this time. Anything that Steven or Peter you'd like to say on that one?
I don't think there's any specific advice. I think it goes with all people with a disability, learning disability, I say autistic traits, dementia, hearing problems. You know, the list is huge. We would respond hopefully appropriately to the particular individual's needs, and if they were able to manage online, that's fine. And if that couldn't happen, then we would use telephone or video consultations. So there's a number of ways of responding, and it'll be up to the individual and the patient's clinician to decide how best to communicate and deal with a particular problem. But that's not just COVID. I think that's just a general principle.
Thanks, Steven. I've got two questions around care staff and unpaid carers. So if live-in care staff come from outside the area, where do they get access to the vaccine? And secondly, are unpaid carers being vaccinated at the same time as the person they're looking after? Good questions.
Unpaid carers who have a read code in their GP surgery as carers will be picked up as priority 2. So it's not so much the employment, as long as they are registered in the individual practice as a carer.
Thanks, Peter. And what about for people who are coming in to look after folk in the area but coming in from outside? Where would they get vaccinated?
Sorry, what's the question, Kathy?
The question was for people coming in, for living carers who are coming in from outside the area, do they get the vaccine here or in the place where they would normally be resident, I suppose?
That's a good question. I don't know is the short answer.
Okay.
I think if they were, actually staying with and actually living with someone as their carer, I think we'd be obliged to try and sort that out locally. But they would have to be either a temporary resident or on that particular practice's system in order for us to pick that up, which goes back to the point that Peter was making. If they're known to us, we should be able to respond. But it's a good question.
Thanks. Yeah, Tony said that live-in carers are regarded as part of the household bubble, which makes sense. We've got a question also from Councillor Tilley about people worried about travelling from Fleet Aldershot because the rates in Rushmore are higher in terms of COVID infections. Is there anything you'd like to say on that question? Again, probably Steven.
That's fine. I think the emphasis there is, you're right. I think we need to recognise that the COVID cases in Rushmore are higher than in Fleet. However, the sites that you'll be visiting are COVID secure, if you like. They have been approved to be designated sites with all the infection control. So you park, yes, you might go in a queue, but you'll be socially distanced, and as such there should be really, if any mixing with residents within those areas. It's very much a confined space dedicated to vaccination, and the pathway through that centre has been scrutinised by public health and approved as being suitable for all those sort of infection control measures to ensure that people aren't put at risk. So
thanks.
Kathy, can I pick up and about the autism? Sarah from the Mustard Seed Autism Trust. So again, Steven had alluded to that. And I think there isn't a better time that we need to work with our local communities to reduce the health inequalities, not just existing ones, but the ones that are emerging for communities and patients who have disabilities. So, you know, we in-house in our practice, we link in quite closely with our social prescribers. We're getting information from housing officers. So this is the time that we really need to connect and gel together as a local community, especially around our vulnerable population. So absolutely to the Autism Trust, Mustard Seed, and any other voluntary organisation to flag things up to us in primary care.
Thanks, Peter. If it's okay with everybody, can we move on just to talk about the Innovation Conference? And then if we've got time at the end, we'll certainly pick up any questions that are outstanding or any others that you've thought of in the meantime. Is that okay, Steve? We can press on to those slides. Okay. So thanks ever so much. Steve Manley's done all the work around this and is the mastermind of this year's Innovation Conference. I know many of you will have been to previous innovation conferences. I mean, they're always wonderful. And I think this year is going to be even more exciting because it's the sort of more ambitious programme. So can we go to the next slide, Steve? And for those who haven't been part of it before, our Innovation Conference has been going 3 years, and the idea is it's a funding programme, but with a massive difference. And what we want to do is give usually quite small pots of money that have a massive impact to local people who've got good ideas for helping the health and well-being in their local community. And it could be a geographical community, or it could be a group of people who share a common interest or a common problem, common ambition. So we've been supporting projects in a wide range of things, and we interpret health and well-being pretty broadly. So some really, really interesting things have been done, and all driven by local ideas. What we want to do this year is to, do you want to move on a bit, Steve? Sorry, is to focus the programme a little bit. And, oh, hang on, sorry, here we go. Seamless. So it's community driven. All the ideas come from our local communities. The way we develop the ideas is that somebody has a great idea, and then in a sense goes through a sort of coaching process with colleagues, with voluntary sector colleagues, with other members of the public who are interested, and they sort of refines that idea, and they get support from that and ideas and contacts, and then it actually helps them deliver a project that is perhaps even more than they'd originally thought of. And you'll see that the amounts of money are pretty small, but they can make a massive difference just to sort of get things going in a local area. Thanks, Steve. So obviously this year we're going to have to be doing it virtually, which is different and will be a little challenging, but should present some opportunities as well. The good news is we've got a larger funding pot available, so that's really great. We'll be able to give more people little bits of money and a few people slightly larger bits of money. So we want to retain all of the stuff that's made the Innovation Conference brilliant in previous years. So huge public involvement, lots of support. It's a very nurturing process, not like your typical sort of fundraising grant bid, which can be a little bit soul destroying. So we've got lots of support for people, formally and informally. Thanks, Steve. So what are we looking for? Well, as ever, we're looking for innovative ideas that are going to improve the health and well-being of local people. That could be an individual who's got a great idea. It could be a small group that's very informal. It might be a little neighbourhood group or a community group. It could be an established charity. So we're really open to all of those applicants. And we really want to build on people's understanding of their own communities. So we're not about to tell you that's not what your community needs. We really want to hear local people's views on what they think is needed in their own communities. And we don't really mind whether the idea is a huge one or a small one, because we can support both. Thanks, Steve. And this year we particularly want to pick up on the impact of COVID, and you'll understand why that is. So we know that it's flushed out and shone a spotlight on inequalities that existed already, and it's also created some new inequalities. So we really do want to try and especially look at projects and ideas that will help address some of the things that have made this pandemic even worse for some people. So some of those things we've talked about today already, like digital exclusion, accessibility, anxiety has been a huge thing, particularly in younger people. So those are just to give you some ideas. That doesn't mean that we will only look at things that fall within this set of criteria, but that's certainly where we want to kind of put the emphasis this year, is to really make the most of this bigger pot, which means we can do more with it. So that's where our focus is going to be. So it's a really simple process. This is not a horrible grant application form that will take you, months to fill in. We want to make it as nimble as possible, and we'll do a virtual conference in March, which we'll hopefully be able to pick up on some of the ways that we've done the conference before. So lots of opportunities to network, share ideas, build your ideas, and then we will be able to make decisions pretty quickly straight after that, so that people can get cracking with their great idea. And Steve Manley is the mastermind behind this. Steve, I don't know if you want to turn your camera on. I'm sure everyone knows you already, but there's Steve.
Thanks, Kathy. I like the term mastermind. I will happily take that. But I can't take anywhere near any of that amount of credit. There's a huge team of people behind it that have been involved for a number of years. But yes, I'm the engagement manager for North East Hampshire and Farnham CCG, and working with some of our wider engagement team to take this forward this year. So we are here, we're at the end of the phone. I'll put some contact details up in a moment, or the end of an email. So if anyone has any ideas and they're just not sure or want to ask a bit of a question about what might be appropriate, then do get in touch and let us know, and we're happy to have a chat with you and work that through. And I think the other thing to say is that obviously with everything going on at the moment, we are remaining flexible on this. So we have got a set of dates attached to this at the moment, and we're asking people to come forward with ideas by the 14th of February. But if for any reason you're not quite sure, or you think your idea might take a bit longer to form, then do get in touch, and we'll keep in touch with all of you should things change, given everything that's going on in the world. But hopefully we'll be able to take this forward and go ahead with this and support the fantastic ideas that we know are out there.
Thank you, Steve. I mean, the good thing about this this process and this fund is you don't need to be a registered charity with X years operation, with annual report accounts and all of that business. It can just be an individual in the community that's got a good idea. So please do spread the word far and wide and encourage people, particularly with this sort of the kind of the COVID impact, which I know everybody has felt so acutely. We really want to try and relieve some of that and make it better for local people. So thanks very much. Do you want to move on to the next slide, Steve?
Yeah, I've got the contact details up there.
Oh yeah, cool.
For anyone who wants to find out a bit more, there's a lot of information on the websites. I don't think we said earlier as part of the presentation, but we're doing this with Surrey Heath Clinical Commissioning Group as well. So if anyone works in or knows people in the Surrey Heath Clinical Commissioning Group area, then they can also apply. And there's information on their website too. We've got a phone number and an email address there that are specific for inquiries around the Innovation Conference. And someone has just asked a question about shortlisting applications. There is a whole partnership team behind this with representation from all sorts of organisations. We have some community ambassadors involved, we have some volunteers, we have the local authorities, and others that are all part of that shortlisting process. But if anyone has a specific interest, then yeah, please do get in touch.
Thanks, Steve. I think that's it. All right, that's the end of the sort of formal bit. Just before we go back and see if we've got any time left for any other questions, I did just want to say one thing, if I may, which is firstly a massive thank you to everybody who is involved in any element of dealing with the pandemic and trying to make sure that other services keep going through this, and everybody who's involved in the vaccination programme. I know you'll all appreciate the stress that particularly frontline patient-facing NHS staff are under at the moment, and it's not going to get any easier in the short term. So thank you to everybody. The message that we're getting, we had a CCG board meeting this morning. It's very much about concerns I know that you all have seen and heard in the media, that maybe people aren't sticking to the guidelines or even common sense as much as perhaps they could do, and as much as perhaps they did a year ago. And lots of us are asking ourselves, what can we do to help? How can we help the vaccination programme? How can we help relieve some of the stress on the NHS? And I suppose the two messages I took away from the board discussion this morning was, one, to sort of model the behaviour that we want others to adhere to, and encourage those around us, our friends and our family and anyone we talk to at a distance, obviously, to just make sure they are really taking it seriously, and to reinforce this this issue of the fact that, you know, the NHS is still running, you know, it's still open, and if people do need it, there are places that they can go. And we've talked a little bit earlier on in the meeting about the different sorts of places where people can get help if they need it. So that's, again, a message that we can all take out to our friends and family and neighbours. So I think that's all I wanted to say, but I'm just going to give my colleagues a chance to just chip in before we run out of time. So I'm going to ask Steven first and then Peter.
Thanks, Kathy. I was just going to come back on Janet's comment regarding supporting potential practices, having the vaccine available for their patients in Fleet. We didn't want to promise anything and set the expectation that this will happen, but it's definitely an evolving situation. We will certainly be happy to facilitate anything we can do to enable that to happen, and it's evolving. So there is more to come with regards to you know, practices getting involved with delivering the COVID vaccination from practices. But at the moment, I think the expectation is to use the main sites and then see what happens when more vaccine becomes available, and what the general steer will be with regards to further distribution of that vaccine.
Thank you, Steven. Peter, is there anything you wanted to add?
Yeah, no, Kathy, I just want to say thank you to you know, members of our community and all the voluntary sector for what they do. And I think, you know, just going back to the point I said, you know, this is the best time that we can stand together, and we can do this, but we can't do it alone. So, you know, working with all the local sectors and our volunteers is going to be crucial over the next 6 to 8 weeks.
Thanks, Peter. Mark, I'm not sure anybody does have a website address for the lateral flow test ordering. I'm not hearing any of my colleagues saying that they know that, but leave that with us and we'll see if we can find out for you. And in terms of the NHS Frimley, Bev, we'll try and put together another separate session where we can talk about the merger and the integrated care system longer term plans as well. So hopefully we can pick up that question there. Daryl, just before we close, is there anything you wanted to say?
No, again, like Peter, just to thank more than 70 people on this call. It's an amazing turnout, and as well as us answering questions, I think the people on this call can help spread the message out to the community that we're trying to give about, that, as that last slide says, that we need people to be complying with the rules. We need people to understand that primary care is still open, but not seeing trivial cases. And finally, just to understand that, I mean, I've been visiting the vaccination sites, and there's an amazing amount of work gone into those, and there's a real buzz and a real feel-good factor about being able to deliver vaccinations, and lots of the GPs, lots of the primary care staff have put enormous effort to get that off the ground very quickly. And as Steven says, it's a fluid emerging situation, and we are still working on delivering, in particular, an improved access for Fleet residents.
Brilliant, thank you. Okay, I think we're probably out of time, but I just wanted to say thank you so much to everyone for joining us. It's really nice to see you. Thanks for all your questions. It's made it really nice and lively. I know there's some stuff that we want to follow up on, so we'll make sure that we think about how to do that and get back in touch with you so you can pick up on those issues that we spoke about earlier. But thanks so much, everybody, and hope you all keep well, and we'll see you soon.
Kathy.
Hello.
Kathy, I asked questions and they were directed to Eleanor Levy. I'm particularly concerned about communications from the surgeries in Fleet, because residents are constantly concerned that they have heard nothing. Can Steven please ensure that whilst this situation evolves, because remember Fleet is now a month behind Yateley, they started on the 14th of December, can he ensure that the surgeries do text or send something out to patients telling them what is happening to them? I heard this afternoon before the meeting that for the first time a Fleet resident has been invited to Aldershot tomorrow from Branksome Wood. That's great news, but it is important to have communications on this major issue, and we can help as much as possible if we're asked. And that's the town council.
Thank you very much. Stephen, do you want to pick that up?
Only that we're getting together with an agreed communications from all the practices and the CCG, so that there's a joined up message and everyone gets the same message, which is you know, at the same time, and then we can put that out. We're working on that right now. In fact, there's an updated message on the CCG website, and we're going to do a very specific comms for all the practices. We're working on that today. I've seen drafts, and it'll be there very soon, I'm sure.
Thank you.
Okay, thank you ever so much, everybody. Have a good rest of the day, and we'll see you all soon. Thank you.
Thank you, Kathy.
Bye.
Bye.
Bye.